Today's interviews. Now, 3 million people lost their jobs in the country between February and April this year. And almost half of all the households in the country have also reported going hungry in the past 3 months. And these shocking details emerged from a new survey that was made public yesterday. The National Income Dynamics Study, a coronavirus rapid mobile survey, which set out to assess the impact of COVID-19 on employment and welfare, showed us these statistics. And it's the largest survey yet to analyze the effects of COVID-19 in South Africa. And simultaneously, we also heard from the Department of Social Development through Minister Lindiwe Zulu when she announced that government plans to introduce a universal basic income grant, or a UBIG, for those within the 18 to 59-year age group. And not much detail has been provided on this universal grant as yet, but the country's structural poverty and inequality still remains at the forefront. So joining us now to discuss this are Isobel Frye, who's Director of the Studies in Poverty and Inequality, as well as Dr Mamphela Ramphele, South African political activist and academic. Isobel and Dr Ramphele, thanks so much for both of you for giving us your time this morning, and welcome to Morning Live.
Thank you very much. And good morning to your listeners.
Perhaps a good place to start, Isobel, is to explain exactly what a universal basic income grant is and what its objectives are, and so that we can all understand what it is that we are trying to achieve if a government starts talking about perhaps introducing something like this.
That's a very good start, Sakina. Thank you. A universal basic income is a cash transfer that is targeted directly to individuals on a regular basis, such as a monthly basis. So the idea would be that everybody within a certain category, and the minister made mention of 18 to 59-year-olds, would be eligible to receive a monthly cash grant. The reason why many people advocate for a universal grant is firstly the ease of administration. So everybody receives it within the category. You don't have to have means testing and the levels of bureaucracy that we're seeing, which are now currently rendering a lot of people ineligible incorrectly. And in addition to that, that leads to the question of areas of exclusion. So many people who strictly are eligible, especially the most vulnerable, find themselves unable to negotiate the kinds of bureaucratic obstacles. Now, many people immediately say, but it's not fair that wealthy people would receive the same grant as poorer people. And of course, we have the recovery through the income tax system. So in many systems where this is in place, middle or higher income people pay back at least once, if not twice or thrice, the value of the income grant that they receive. As you ask, the reason why many people use this as a policy instrument is that it's an immediate way of getting cash or income into the hands of people, firstly, who are destitute. And you mentioned the reporting of at least half of South Africans going hungry. We know that that comes off many, many years of hunger and poverty in South Africa. But secondly, and this is, I think, the most important reason why people are talking about this now, stimulus into the economy, which has been broken through COVID, by giving income into the hands of people who from the bottom up can start demanding and consuming, and so getting the economy going. And I don't think we should see this as welfare. I think we should see this as an indication of a social democratic state that's stepping in when its citizens and residents need assistance.
And we are asking, about this in our question of the day this morning, Dr. Ramphele, and looking at some of the responses coming through, very interesting already. But I want to quote you, Dr. Ramphele, in a 2019 article where you said, and I quote, "Our social development programs are too focused on welfarism and too little on healing the social pain that is overwhelming so many adults and children growing up in our highly unequal and violent society." So what would you say, Dr. Ramphele, to those who would argue that this would create more dependency and more welfare that the state could ill afford at this time?
Sakina, I think we need to distinguish between emergency interventions, and long-term development investments. I believe that the world recognizes that with COVID and its devastating impact on people, interventions such as these are absolutely essential. In fact, we thought this is what the announcing a few months ago when they were talking about cash transfers. But what I do want to emphasize is the importance of thinking about or embracing the idea of guaranteed programs alongside this, that we should be looking to have this basic income grant for the, let's say, for the rest of this year. Alongside that, we need to look very, very seriously at massive guaranteed employment programs to build human settlements that will promote dignity. What we are witnessing in South Africa is a massive devastation of families, of communities, and the fact that the president had to withdraw the allowing of alcohol is an indicator of just how wounded this society is. It's not going to be solved by simply transferring grants to people. People need sources of healing and dignity, and the dignity of work. And I'm not talking about the current public works programs. I'm talking about public work programs that are very systematic, that add value. Let's take a place like Diepsloot. Why do we have Diepsloot just next door to Johannesburg, but we can't have basic infrastructure for the people of Diepsloot? The other day, we opened an absolutely amazing school, a LEAP school, which demonstrates the value of the private sector partnering with the public sector, partnering with communities to build high quality infrastructure. That's what I believe the rest of the year should be spent planning and executing on this guaranteed employment programs, because what they do ensure full employment for those who want to work part-time or full-time. It ensures minimum wages that are not poverty wages, and benefits such as being able to access support for welfare, for health and other needs, and training of people. If we're talking about the 18 to, let's say, 40-year age group, most of those young people are loitering in the streets. Just giving them cash is not going to solve the problem. Yes, giving them cash so they have food is one thing. But in the process, please let us create platforms for guaranteed employment programs that will give them the dignity of work, the ability to improve their skills and restore their dignity. And those programs should have a very strong psychosocial intervention side to them. So, like the kids that I was talking about at Diepsloot Leap School, those children are in the same environment, but they are leaders. Why? Because the school is using life orientation to get the kids to talk about the pain in their hearts, about the domestic violence, about the violence in the street, and how they can develop their own skills, their own souls, so that they can be able to survive in this very, very challenging environment. So I believe we should not just look at grants. Let's look at this guaranteed employment programs which are being implemented even in places like the United States.
A very interesting notion there, Dr. Ramphele. Isobel, 3 million jobs lost currently due to COVID-19 and growing, with about 17 million people we already know on social welfare grants already. And if we look at National Treasury's estimation, they're talking about up to 7 million jobs that could be lost. So this looks, like the picture is going to get worse. But the question around the basic income grant in this instance is, of course, its funding. How is it going to be funded, given that people are losing their jobs, thereby placing more pressure on the tax system? How do we actually go about funding this if we get to that point?
Absolutely, Sakina. And the point is that this is not business as usual. So the question of funding sources is one that a number of people have been writing about in the public sphere. Mention has been made of the Government Employee Pension Fund, looking at sources under the PIC, but also looking at quantitative easing, the ability of the Reserve Bank to buy up current government debt and therefore increase spaces. One of the things that many people argue is that the multiplier effect of a cash transfer system such as this has immediate benefit, because as people consume, so they're paying VAT, and so they're extending the reach of the coffers way over and beyond the income tax base. We've also seen, Sakina, however, a rapid reduction of corporate income tax from 50% just before 28%, the effective tax rate. So that's something which needs to be looked at. We've talked a lot in the past about the introduction of a wealth tax, the introduction of a transactions tax. It's the issue of being bold and courageous. As everybody says, we don't know what the future holds. But I think that an adoption of something, the universal cash income, means that we have some control over our destiny, because we are addressing that. I just want to speak very briefly on Dr. Mamphela's discussion around employment, and that definitely is a way of seeding the kind of society we want to shape. I think the crisis we're in right now means that we have immediate needs, as well as looking at longer term. The employment guarantee scheme is something which has been piloted by government. The point is that it takes intermediaries who need to come in and distribute the kinds of skills and trade. I don't think that she or I are talking at odds with each other. I think there definitely is an alignment between meeting immediate needs and looking at longer term skills. But also we still need to address the apartheid infrastructure and the underdevelopment. And we hope, however, that by giving people cash in their pockets, they're able to contribute to have food so that they can participate fully in the kinds of decisions and actions that are required to take us as a nation out of the COVID crisis that we're in.
And again, just looking at some of the responses to our question of the day, some are saying, is this not going to create a situation whereby people become lazy if they are guaranteed this basic income every month? But I guess there is some information, studies that were done previously that would prove the contrary. But Dr. Ramphele, all the same, on reimagining the South Africa that we want to see, you say that we do have all the ingredients for success. So the choice is ours, whether we recommit to reimagining our own country and our own future into a great society that it can become, or do we continue to hesitate at the threshold of a new, brighter future, is what you say to us. But how could that future be realized, this future that would be of benefit to all South Africans?
You know, there are many examples of young people. On Saturday last week, I was part of a webinar by an organization called Ubuma. These are young Black men who have taken it upon themselves to tackle this issue of gender-based violence and to mentor younger people. Now imagine, Sakina, if each one of us were to get involved from where we are, in our homes, in our communities, to just reach out to groups of young people. Let's assume that we go through with this basic income grant. At the same time, we need to reach out to these young men who are standing around in the streets, who are completely lost because they don't have a sense of self. We've got lots of churches, we've got lots of private or civil society organizations. We need to have a game plan. How do we reach out to young people, men and women, so that they can do this reimagining with us? And one of the areas which we have failed to leverage is life orientation in our school system. I know there is talk about schools closing. Yes, they might close. Stop us having online programs. And this is where our government has to recognize that this delay in rolling out internet connections to the poorest people is a bottleneck. Because with that, we could have young groups of young people in every ward, in every street, and so on, meeting with someone who can guide them about what does it mean to be a man when you grow up without a father or in a broken home or in a child-headed household. What does it mean to be a woman? Why do we have so much in the line of teenage pregnancy? It's because young people have no guidance. And when they do get the guidance, Sakina, it's amazing the talent we have in our society. And that I've seen with my own eyes in LIP schools, wherever they are, in the poorest areas, in the likes of these Ubuma, and lots of other interventions by young people themselves. Let us reach out to these young people and have people who are professing to be ministers of the word, pastors. Let's defocus on this money business and focus on the souls. Healing the souls of this nation is what will stop all these ills like abuse of alcohol, drug abuse, gender-based violence. But guaranteed employment programs give people a purpose in life and a sense that I am contributing. Yes, it is to make sure no one goes to bed hungry. So I support the income grant, but let it be partnered with a set of healing programs that help to rebuild our nation to get people's souls, their minds liberated from this worthlessness, lack of self-respect that leads to these destructive behaviors.
Well, thank you so much, both our guests, for your wonderful insights this morning. Dr. Mamphela Ramphele, a South African political activist and academic, as well as Isobel Frye, Director of the Studies in Poverty and Inequality Institute, sharing their views on how South Africa could build an inclusive society on self-sustainability and, of course, on human dignity for the masses of people left outside the economy. Really enjoyed those insights, and I'm waiting to hear your views on it through our question of the day. But